what we do is we actually come in and pin and hold, work that tendon. So I'm actually connected onto that bone, right? So hold that and wait for that muscle or that tendon to dissolve. So it's actually right up into the clackers of it. It's right up under there. And then we can also gouge it out. So you're sort of like working down and out and give it a little bit of curry. Alrighty guys, it's Das Ninja here. We're talking hamstring tendonitis. So something that I see in a lot of my clients is this pain that they feel right up high on their sit bone, that ischial tuberosity. I'm going to give you a little bit of background on some anatomy here using our book. So I'm going to show you where our hamstrings all originate or where they attach right onto that ischial tuberosity. So all three, our bicep femoris, our semitendinosus, and our semimembranosus, they all originate in the same spot. And yes, I think it shows us on this guy over here. You can actually see that the short head attaches onto the femur. See down here, man, you can see it attaching onto that femur. So that's actually quite interesting too, which works really well with the style of treatment that we do. We're always connecting into the tendon. The tendon is where the part of the muscle attaches onto the bone, right? And that part of our tissue has the least amount of blood supply. So that's why our treatment is so effective at I guess, ridiculing or eradicating the pain and the discomfort that people feel. So one thing that doesn't work with tendonitis, and this is globally for anybody that has tendonitis anywhere, from their Achilles to their quad to their shoulder, is stretching that tendon. Think of a frayed rope, yeah, holding onto something, right? Like a boat or something in the wind. And that frayed rope is becoming more frayed the more you stretch and the more you pull on it, okay? So stretching is a no-go. The one thing that it needs is load and sustained pressure. So sustained pressure meaning getting my thumbs, getting my elbows. See that red mark that I've just left there already? That's really good because I'm actually impacting all three of those hamstring muscles and that tendon. So I like to actually get in here with my thumb and pin and work that. So sustained pressure, the reason that it works so well is because it allows the body to relax and you're pinning that tendon and getting and encouraging blood flow and cells into that area. As I mentioned, the tendons don't have the same blood supply as the muscle belly, right? Now, this guy gets irritated for multiple reasons. He could be somebody that spends too much time sitting down in the car.
For interrupting your video, guys, but I want to talk to you about the MMT Online Academy. So you might have been looking at Ninja and I doing our stuff for a long time now, thinking, how good would it be to work at MMT? But you might be overseas. This is your chance to get exclusive content updates from us every single day to make you a better practitioner, more new customers, better results, and skyrocket your income. So if you want to be on the inner sanctum, get into the academy. All you got to do is dedicate 5 minutes a day to making yourself better, and it's just 28 bucks per month. How good's that? $7 a week. Let's go.
And then you go and try and perform, like you go and try and run or train for footy or get in the gym and go and do deadlifts or squats, and you've been sitting down for too long. That sit bone is connected to your chair or connected to your stool or whatever you're sitting on, the hard floor, and then you're trying to load that tendon. It becomes irritated, it becomes angry, and it doesn't have that same performance as it should, because I guess it's got pain resided to it. So what we do is we actually come in and pin and hold, work that tendon. So I'm actually connected onto that bone, right? So hold that and wait for that muscle or that tendon to dissolve. So it's actually right up into the clackers of it. It's right up under there. And then we can also gouge it out. So you're sort of like working down and out and give it a little bit of curry. All right, I'll show you with an elbow, same thing. So the best thing about an elbow is it's more broad and I can collect more of those tissues. So yes, the interesting thing, they all start in the same spot. Our bicep femoris comes down laterally and our semi-tem and semi-mem come down and insert medially to the knee. But as we saw earlier, if I spin around that way, you could see that that bicep femoris, the short head of it, has attachment sites all the way down the femur. So we can actually get bone level deep and do a nice clean out of that tendon. So you're collecting all that tissue the whole way down. Oh. So just pinning and making sure you're working really slow, because the faster we go, the more you're going to irritate it. Think of a frayed rope, as we said before. If you start to really, work into it and like gouge at it and poke and prod at it, it's not going to respond really well. So go slow, connect, and clean out the build-up. Get rid of those little speed bumps and adhesions. It's as simple as that, right? So tendonitis, remember, don't stretch it. You can get on this with a ball, like you can use a massage ball. We've got our purple MMT balls. You can get a partner in here at home and try and get in there and see what they can do with their elbow or their thumb. But this is the best way to do it. Come in, see one of our therapists, see if they can help you. Stop living with pain, stop living with discomfort. Come in and do something about it. All right, and I'm just going to trace that all the way down. I'm going to focus on that bicep femoris. It usually is the main culprit. It is our more, I guess, we recruit our bicep femoris with most sports more than our medial hamstrings. I mean, we do in tennis and things, and when we're working laterally.
Hello, Patreonos!
Patreonos!
Check out our latest Patreon releases.
Oh, what? He's there. Come on, show your legs.
Please, my turn.
Yep.
Right, I'm done.
Patrono pole dancing for you. Oh, yeah, I'm going.
All right, grab them.
To join, click the link in the description.
Sorry, Ninja, haven't got a lot of wax there. That's
No,
all right.
that's
We're
fine.
making-
It's not the
making sure-
wax. It's fine.
Making sure we're doing a really good fascial stroke through there as well. So that's our first phase. Make sure you clean it out, gouge, pin the tendon, hold it, weight with weight, and see how your muscle responds. Yes, you'd need a full half an hour session at least with one of us to be the most effective. But yeah, let's see how you go. Second phase of our tendonitis rehab, and that is loading the tendon. So we've got Ninja here, nice 90 degrees, feet aren't too high or too far apart. You're gonna lift your pelvis up, Ninja. And what we're encouraging here is a posterior tilt. A lot of people that we see, they have an anterior pelvic tilt, meaning the hamstrings are long and taut, meaning long and weak. Now we're encouraging a posterior tilt, tucking that pelvis under just like that, and loading and holding this pressure. So isometric contractions work really well with tendonitis as well. We don't want to move the joint through shortening and lengthening phases. We just want to shorten, contract, and hold. So Ninja's been here for about 20 seconds. What we're going to do now is progress that. Bring this knee towards your chest, Ninja. Good. And have it up a bit higher, just like that. And we're going to hold for another 10 seconds. His cue here is to drag that heel down on the floor and really get a nice contraction in that hamstring. Looks really good. And just have a little rest. Good. And one other progression we can do to that, Ninja, is do the same thing. Come up. Now what you're going to do is like a calf raise. Lift this foot up like that, exactly, and drag the heel down. So when we're on our forefoot, we're going to get more distal down here, okay? So we're going to get more of the behind the knee and the calf. Go the opposite, man, and just put the heels down. So, yep, and now lift the toes off and drag. You're going to get higher right up into there. So that's where we were focusing on with our treatment, that high origin site, that attachment point of all those hamstrings. And again, looking to hold for 20 to 30 seconds. Isometric contractions, these work really well with any of that tendonitis. Have a rest, Ninja. Beautiful. Give it a go, see how you feel, and hopefully this can help to fix your tendonitis in your hamstrings.
Get it done.